name is Nikki, and I'm going to be putting an NG tube in this patient. And the first thing we want to do is get the physician's order and make sure that everything is right patient, date, everything. And make sure we want to look at the history, the nasal surgeries, if there have been any, anything like that where we could injure what's been done, any sutures or anything. And once I've done that, I'm going to go ahead and gather all of my supplies. So they are over here. And when I go into the patient's room, I'm going to knock, enter, identify myself, greet the patient, and I'm going to wash my hands. So I'll go ahead and wash my hands, I'll provide for privacy, and I'll go ahead and identify the patient by two means. So I'll ask them their name and their birthday and check that with their wristband. I'll go ahead and assess mental status at this point and just kind of ask them their name again, where they are, what day it is, things like that. And then once I've assessed the mental status, I will go ahead and explain the procedure to them to make sure they know what's going on. So tell them that we're going to be putting a tube down their nose into their throat and just down to their stomach so that we can feed them and do things like that and give medicines, things like that. So once I have my supplies and everything and the patient knows what's going on, I'll assess the abdomen. So I'll look at it, make sure everything looks okay, no distension. Then I'll listen. Make sure I hear bowel sounds in all 4 quadrants. And I'll listen for 2 minutes in each quadrant. If I don't hear anything in either of the quadrants, then I'll listen for a full 5 minutes. So once the abdomen's okay, then I'm going to go ahead and establish a stop signal with my patient. So whenever I insert it through the nose and it hits the back of the throat, they can give me their stop signal. That means that they can stop for a second, take a drink of water, put their head down, and we can insert the tube a little bit further. And I'm going to make sure that the patient is in high Fowlers. So at least a 90-degree angle. And we're also going to assess the nares on the nose to make sure patency is good, whichever one we decide to do, make sure there's no skin breakdown on the nares. And then I'll go ahead and put a towel over my patient's chest to get them ready. Put on my gloves. And once my gloves are on, I'll go ahead and measure the tube from the tip of the nose to the earlobe and down to the xiphoid process. And I'll mark the tube wherever my measurement is. So you're going to take it from the tip of the nose, earlobe, down toward the xiphoid process. And I'll go ahead and mark this measurement so I know where to stop. And then I'll go ahead and get my lubricant out, just so it goes down a little bit easier. Once it's lubricated, I can go ahead and insert the tube into the nose. Once I hit the back of the throat, the patient will give me that stop signal. And when I do insert, I want to make sure that the head is tilted forward slightly. And then once I insert it, give me the stop signal, we'll take a break, and I'll go ahead and give them the water. Once they've taken a sip of water, they're going to put their head or their chin to their chest so that we can move the tube down further once they've swallowed it down. We're just going to slowly insert it until my marking. Alright, so once the tube is in, I'll go ahead and tape it where it needs to be on the nose. Alright, so once it's secured, I'll go ahead and check the placement of the tubing. And for that, I'm going to just measure the aspirate. Alright, so I would unclamp it if it's clamped. Go go ahead and put my syringe on. I can release this, and I'm just going to pull back about 10 mils of stomach contents. And I would be observing the color of the aspirate, and then also make sure my patient's not in any respiratory distress. And I have a pH strip, and we're just going to put that on the pH strip. And if it's around 4 or less, that means we know it's in the stomach because it's acidic. If it were any higher, like in the 6 range, we would know that's probably not in the stomach, maybe in the lungs. All right, so I have this clamped off when I took the syringe off. And then whenever I went ahead and clamped this so nothing comes out, and whenever the placement was done by the pH, we would go ahead and send them to x-ray just to get a more confirmed placement. And then whenever they get back from x-ray, we will go ahead and mark the tubing again just so that we know it's in the right place since we didn't see them. So you would, again, check this. You would measure how much of the tube is left, and then you would document that. And you also want to make sure that you never reposition an NG tube if they had gastric surgery, because you don't want to damage anything. All right. So I have clamped my tube after I removed my syringe, and it's capped on. Then you would secure it to the gown or to their face behind their ear, somewhere where it's not going to move and pull out on accident. And whenever you're done with that, you're going to do the oral hygiene. Oral hygiene and probably your nose as well, just so that everything's clean. And once you're done with that, you can go ahead and put the patient back down to a safe position with their call light. And once they have the call light and they know how to use it, you can go ahead and take off your gloves, wash your hands, and you can report and record your findings.